expansion of the mandibular arch, that's the lower arch, using the Trombone Appliance. I've taken this example specifically. It's not an appliance I use very regularly, although I should possibly use more of them for adults in certain situations. But it's a good example of what's possible within orthodontics. I am frequently asked by individuals if it's possible to expand, widen the lower dental arch, the mandibular arch, by individuals who've been told categorically that this is not possible by their orthodontists. And here we enter a problem within orthodontics. Orthodontics is very much an art rather than a science. There is not a huge degree of conformity between orthodontists around the world, often with different groups in different countries, thinking and coming to completely different conclusions based on, well, I would assume the same research, since we all share our research more or less. Research quality is not particularly good within orthodontics, and it's very difficult for someone to tell me what I can't do if they can't do it. There's an important understanding in that. Now, here we have the trombone arch, and the trombone arch is it uses the small little night-high coil springs enclosed within some sliding tubes that can progressively widen arches by producing quite a constant force, and these two arms that can widen out the lower mandibular arch. And it's a very effective method of doing so. And I've chosen something specifically because I don't do it often. So here's another group of people who are expanding or widening the mandibular arch, getting some good results and some quite wide expansion. However, I still caveat all of this with, if you're going to widen the mandibular arch, you have to change function and posture at the same time. So I would agree with many orthodontists that if you don't change the rules of the game, you can't widen the mandibular arch. However, if you change the rules of the game, well, you can do whatever you want within limits. But this is a good example.